Hi, thanks for joining us again. Dr. Jeff Hedrick here. Today we have a treat. We're going to be speaking with Barbara about her Shockwave treatment for her knee. So please welcome Barbara. Thank you for taking the time to come in and talk to me about this. And can you tell us what was happening in your knees that was causing such a problem?
Both knees would go out of place, just at random, and I would just bump into something with my right knee, and then it would shift to the left, and then it would lock, and I wouldn't be able to I wouldn't be able to stand or put any weight on my leg because my knee was locked.
So you were having a problem where the knee was shifting its position, and you felt it go out of the normal position.
Right.
And then it would lock there, and you were having trouble putting weight on it. So was that pretty painful?
Yes, it was.
Okay. Now, how frequently was that happening?
Probably every day.
Daily? Okay.
Yeah, I would say so.
And for how long?
How many years or how many minutes?
How many years?
Oh boy, that goes way back. Probably since I was a teenager.
Oh, so quite some time then.
Yes.
It's been a long-standing problem that you've dealt with for decades, right?
Yeah, right.
Okay. And you started Shockwave about 3 months ago. And tell me, how are things different now?
Well, now I don't have to be afraid of my knee going out. Both my knees, actually. I don't have to worry about or watch how I walk or if I bump into something with my knee. And I don't have to worry about getting in and out of a car because that's when it would happen often. My knee would go out then too.
So when you went to stand up and get out of the car, you'd feel the knee shift out? Yeah. And so now you feel more confident in it?
Yes, my knees are much stronger, and I have a lot better flexion, or I'm able to bend my knee quite well.
Okay. So before we started Shockwave, you were having a trouble bending your knees, right? You didn't feel like you had good range of motion in there?
That's right.
And was it a painful range of motion too?
Yes, it was. When I would try to pull my knees towards my chest, I could barely do it because my knee just didn't want to move.
Okay. And now there's less pain in the knee and better range of motion, more stability, and you feel you can do a lot more things without worrying about the knee?
Yeah, I don't have to be always thinking ahead of time, if I do this, then my knee will go out of place or whatever, and I don't have to push it back in. I would always have to push it back in. And then it would sometimes go and sometimes wouldn't.
Okay. So sometimes you would try to correct it and it wouldn't go back into place, but now you don't have that problem anymore. So we're almost finished the treatment, and a lot of people want to know, what is the Shockwave like? What does it feel like to get it done? And I often point out to people that at the early stages of treatment, the sensation is stronger because the tissue is more damaged. And you felt that too, didn't you? And then after about 5 treatments, it started to feel better during the treatment and not so strong. And now, how do you describe the sensation of the treatment?
Well, now it's kind of like a needle pouncing on the skin, but basically it doesn't hurt at all. I mean, it's just something to notice and gets your attention, but it doesn't hurt like it did before.
And you had said too that after the treatment you feel something. What is that?
Yeah, I get that warm fuzzy feeling in both knees.
Yeah.
I get that. And just stays with me, you know, the rest of the day at least. And I like that feeling.
Okay.
I haven't felt that good since I was a teenager.
So you feel better now than you have since you were a teenager? So are you pleased with your Shockwave experience?
Mm-hmm.
Yeah? And do you recommend it?
Oh, yes, yes, I would have sure would have done it when I was 16 and playing basketball and in high school. You know, if I could have had this treatment then, I would have been a lot happier and would have enjoyed my high school a lot more.
Yeah. But it wasn't too late to do it now, was it?
No,
Okay.
no, it's never too late because that's one thing that I object to is doctors writing you off because you're over 60 or 65 or whatever because you're useless to society and now your body doesn't matter anymore. And that's just not true.
Mhm. Yeah, that's great. Okay, so thank you for taking the time to talk to us. I really appreciate it. And I think a lot of people will also appreciate getting to hear your story and when they're making a decision about what to do about their knees. Because as we know, knee problems can be very painful, very limiting, and they take a lot out of people's lives. And we're trying to get people to have a better life now. Okay, thank you.